Hi everyone, my name is Oluwaseun. So today I'll be talking about what can you do with your doctorate degree in public health. One, you have two choices. You either want to be in academia or you want to be in research. If you want to be in academia, you either want to be a lecturer, you want to be a professor. If you want to be in research, you have four options according to my research. You either want to be an environmental scientist, protecting human from environmental hazards. 2, you want to be an epidemiologist. 3, you want to be a medical and health service manager. You want to be a medical researcher conducting trials in the lab. So before even thinking about this doctorate, what are the things you need to have at hand? 1, you need letters of recommendation from your supervisor at work if you are the type that that's already on the field, that's working already. Or you get your letter of recommendation from your lecturer in school or supervisor in school. 2, you need your GRE test scores. 3, you need your resume. 4, you need to prepare for your interview because schools need to test if you are fit into the doctorate program. 5, you need statement of purpose. Why do you want to go for your doctorate degree? So as a public health professional, after this stage, you need to think about it. What schools are the best for your doctorate degree in public health? I have 5 schools that I can recommend, but you must not attend those schools. You can go to Harvard School of Public Health, John Hopkins School of Public Health, London School of Hygiene and Tropical Medicine, Yale's School of Public Health, Stanford School of Public Health. Even after this recommendation, if you think about it and you think not to, maybe you can't afford those schools at the moment. They offer scholarships yearly for doctorate programs. Even if you think you looked at it and it's not within your plan, you look at it that it's not doable for you. Let me just use the word doable. Look around you. There are universities that you can afford. There are universities that you can achieve the same results like these top 5 schools that I mentioned. You just need to do your research. How do you do your research? 1, you don't want to do your research through the groups you belong to, your associations. Most of us, as a public health professional, you agree with me, you are either in one professional association or the other. Ask questions. Use these associations. Don't just join them, for the sake of, I'm associated to this group, I have this group, and you are not using your resources. I am sure some of us are paying monthly fee to be in these associations. You can do it locally, and this one is very free, through Facebook groups. As a professional by now, I want to believe that networking should be your priority, should be on your top list. If you go to Facebook groups, ask people there, I want to attend so school. What are your experience so far? People will tell you if the school is worth, spending your time on. What do I mean by that? Because you really don't want to go for a doctorate for the sake of going for a doctorate. You want to do your research work. You want to get the best out of it. Remember, the 2 reasons why people are going for doctorates is 1, to either be employable, to be vast in their field, or to learn more. You have 2 reasons why people go for doctorate: to learn more or to be employable. So, and as a professional, after doing all these things, there are 3 things you need to consider before going for your doctorate. 1, do you have the time it takes to put into your doctorate degree? 2, your budget. What is your budget for your doctorate degree? How much do you have? How much can you afford? 3, do you have the support you need? What I mean by support is support system. I mean, it could be your lecturers, it could be your former lecturers. There are times whereby the work is going to be overwhelming. Do you have people in your corner that you can go and meet, and express how you feel? I mean, your support can be your mentor, because by now, for you to proceed to doctorate in public health, I want to believe you must have had a mentor. So you have the support you need. You need these three things. Think about these three things before going for your doctorate. After you've done all these things, ask yourself, this doctorate degree, does it meet up with my career goal? As a public health professional, your doctorate degree, you need to think about it. Is it going to help you in one way or the other? Even though no knowledge is wasted, as human beings we aim to advance. For me, doctorate degree should be another level of personal development. As we grow, our goal changes. But at the same time, I want us to have the right reasons why we are doing some certain things. Then, two, I want you to think, the skills you have gotten with your graduate school certificate, have you used them in any way? You have to think, you have to be able to use these skills. We want to get certificates that, that has helped us improve in our skills one way or the other. At the same time, we want to be able to dispense these skills. Look at your career, like so far, what have you done? Let's say, for example, you have been maybe a program officer all your life. Is this doctorate going to help you in one way or the other? Is it going to advance your career? Those things are important to be able to decide what doctorates, how it's going to help you and how it's going to make you employable and versatile. I hope you've been able to learn one or two things today. Thank you so much, and please kindly subscribe to my YouTube channel.